only premature babies that go to the NICU. There are 6 other reasons why a baby might need NICU care that all parents should know about. Hi there, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and NICU to decrease fear and increase confidence. Prematurity, which are babies born under 37 weeks, is the most common reason why a baby will go to the NICU. This is obvious because babies born premature will need help with their breathing, will need help feeding, growing, everything. But there are 6 other reasons that you might not know about that can cause your baby to go to the NICU. All of these reasons will affect a full-term baby that is born after 37 weeks. The first reason is any baby that is born and has any breathing problems. Any baby born full-term and they're gasping, grunting, making any funny noise, or even not breathing will come to the NICU to be assessed. This is because full-term babies' lungs are fully developed. So when they are born, they should be coming out crying and moving around. So if a baby comes out and has any breathing problems at birth, they will most likely go to the NICU. In the NICU, the baby will be put on a breathing machine depending on how much support they need. Also, chest x-rays and lab work will be done to figure out why the breathing problem happened in the first place. The baby stays in the NICU until they can breathe on their own really well and are eating great. The second reason why a baby might need NICU care is hypoglycemia, which is low blood sugar. These are babies that are born with diabetic mothers or babies that are born that are small in size for their age. For babies that have diabetic mothers, they are so used to living in high sugar environments, therefore their little bodies start making a lot of insulin to decrease the blood sugar while they're inside. Once they are born and the cord is cut, their body is still making the insulin. Therefore, it causes the blood sugar to crash. For babies that are small for their age in weight, can also have blood sugar problems. For example, this would be a baby born at 39 weeks, but they weigh only 5.5 pounds. This is because when they're born small, their body doesn't have enough glucose storage to keep their blood sugar levels normal. Both of these babies might go with their mom onto the postpartum unit, but they will be watched very carefully. If any of these babies have really low blood sugars that is not coming up with just feeding, then that means they would need more medical interventions. Therefore, they will be coming to the NICU for that. In the NICU, they'll most likely get an IV and continue to feed, and also there will be continuous blood sugar monitoring. These babies stay in the NICU until they can maintain their own blood sugar without any IV and are eating well and are growing well. The third reason is jaundice. After a couple hours after the baby is born, it is normal for them to get jaundice. Jaundice is the yellow coloring of their skin and of their eyes because of high levels of bilirubin. This is from all the changes and breakdown of the red blood cells in their body, and to get rid of that, they need to be pooping. Jaundice can be treated in postpartum, but the reason why they would come to the NICU is when the jaundice is really, really high and it's not coming down, and they need intense phototherapy lights. Really high and untreated jaundice can cause brain damage and deafness. Also, jaundice can make the baby very sleepy and not eat properly. These babies are in the NICU for a couple of days to a week, just until their jaundice comes down and they are able to feed better because they are more awake. The fourth reason is a congenital defect. Any congenital defect that the baby is born with would be admitted to the NICU for further monitoring. These physical abnormalities are usually seen in the ultrasound during pregnancy, so parents are usually aware that their baby might need NICU care. Depending on what the congenital defect is, these babies might need breathing support, temperature support, and other medical interventions. The most common congenital defects found in babies are heart defect, cleft lip, kidneys, spine, brain, and genetics, which could be, for example, Down syndrome. These babies are stabilized in the NICU and are helped with feeding and growing. Then eventually they'll be followed by a specialist in the hospital, and when they go home. The fifth reason for NICU care is drug withdrawal. This is a baby born to a mother who has been using recreational drugs in her pregnancy, or a baby born to a mother who's using a prescribed medication that can cause withdrawal. For example, a prescribed medication that a mom might use is SSRIs, and these are antidepressants that a mother needs to use for her mental health. Some babies, not all, that are exposed to SSRIs might show signs of withdrawal, which needs to be closely monitored in the NICU. If a baby is going through withdrawal and they are not closely monitored, they can have seizures, diarrhea, and other neurological complications. So in the NICU, these babies are very closely monitored, and they might be given a small dose of narcotics to help with the pain of withdrawal. The sixth and last but not least reason is infection. Any concern with infection comes to the NICU right away. The infection can be caught during labor or after the baby is born. Risk factors that increase the chance of infection include GBS positive, if your water has been broken for many hours, UTIs, STDs, or if the mother or baby develops a fever during labor or after birth. Any baby with a risk of infection is started on antibiotics right away in the NICU, and many lab work is sent, such as a blood culture and a urine sample. These babies are on antibiotics for a couple of days to weeks. Comment down below if you've had a baby or know of a baby that went to the NICU for another reason besides prematurity. I actually really want to know because it's more common than you think. Wondering what prematurity actually is and what kind of challenges these babies might face in the NICU? Check out the next video to learn all about that.